Hello and welcome to Consider This. My name is Heidi Beidinger. My co-host Marianne McDowell and I would like to present the COVID-19 data for St. Joseph County each week because we want to be able to provide the latest data regarding new cases and active cases in our community. We thought that it would be helpful to provide a short video ahead of each week's presentation so that we could discuss the numbers together and do some learning together throughout our time on this webinar, which will take us into December. It is our hope that that the terminology and the statistics that we're going to be talking about will become familiar to you so that you have the tools so that you can do these kinds of analyses on your own and into the future. So let's go ahead and get started. So here we have our first chart, which reflects the new cases, the new COVID cases here in St. Joseph County. And the statistical analyses that is done to develop this statistic is called a 7-day rolling average. And this statistical process is used to smooth out the data series. The purpose of the rolling average is to identify long-term trends. And the way that it is calculated is that it takes the previous 7 days data, so the new cases that are occurred on each of the previous 7 days, and then it is averaged. So for here on September 11th, I went back for about a month. So again, we're going to watch these trends during the time that we're on the webinar series together. So on September 11th, there were 40 new cases. And as you can see, this blue line, the trend line, you can see that we are having an increase right now. And we are currently hovering at around 74.1, and that was as of a few days ago on October 8th. So the chart here to the right that has the stoplight colors, this was a chart that was developed by the St. Joe County Department of Health to help educational leaders to make decisions about face-to-face instruction in their buildings. And so to interpret the numbers that we see here in this chart, we go over here to this table to interpret what those cases mean for our decision makers who are in the schools. So if you're having greater than 28 new cases per day, you're in the red zone. And so then it's strongly recommended that you do e-learning or you severely limit the in-person instruction. If you're having 14 to 28 cases per day, then you're in the yellow zone and you want to consider a hybrid model or reducing the capacity or the number of staff, personnel, and students that are in the building at any given moment. And then if you're having less than 14 cases, you're in the green zone. And then you are considering having in-person instruction at the usual capacity. But from what you can see here, the trend right now during the last month is that we are on an increase in St. Joe County. Our next chart here talks about the active cases for the preceding 14 days. So this is very similar to how the new cases are calculated. This is looking at the number of active cases on each day of the 14 preceding days, and then taken the average. So again, let's look at this chart. So on September 10th, we had 847 active cases. And again, this means all the cases that are diagnosed in our county in St. Joseph County. So these are folks who can be asymptomatic, have mild symptoms, or are actually having a very serious episode with the COVID infection. So we had 847 cases, active cases on September 10th. And as you can see, we took a little bit of a decline. And very similar to the new cases, we are now on the rise with active cases, and we're at 1,091. If we come over here to our table, it tells us that we're in the red zone if we've got more than 400 active cases. We are in the yellow zone if we are between 280 and 400 cases, and we're in the green zone if we have less than 280 cases. And as you can see from the 1,091, we are well above the 400 active cases. This is another important statistic, and this reflects the positivity rate of those who have tested for COVID. So the way that we calculate this statistic is we take the total number of people who have tested positive and divide that by the number of people who've taken a test on a particular day. So let's again look at the chart on September 10th. We had a 6.4% positivity rate. We dropped down and stabilized for a little bit at 3%. And now we've seen an uptick with a slight decrease. And now we are hovering at the 4.4%. And if we look over here again at our guide, you'll see that we are coming in the green zone. So we are below the 5% and giving the green light for in-person instruction. And the final statistic that we're going to talk about is called the R-naught estimate. And this, said another way, is the community transmission rate in a given area, given geographical area. This is a very complex statistical process that takes into account several different factors like biological factors, socio-behavioral factors, and environmental factors. And scientists or modelers, epidemiologists, have many different ways of arriving at their estimate. So for us, on September 10th, again, we had 0.36 R-naught estimate, and then we saw an increase to 1.11, and then we are now at a decrease, and we are at 0.76. So what do these numbers mean exactly? So in any given circumstance, when there is a person who has COVID, who is positive for COVID-19, if they are transmitting to, if we have a transmission rate that is above 1, that means that they are passing the infection to at least one other person or more. If we are seeing these very low numbers of transmission, below 1, then we are estimating that the cases are shrinking. So again, when we're seeing these numbers that are below 1, we can say that the cases are shrinking. When we see rates that are above 1 or 2, 2.5, then we know that we have significant transmission going on in our community. So right now we are at a 0.76, which puts us in the yellow zone, just above that range of 0.7 to 1.5. So you might be saying to yourself, okay, so we've looked at these 4 data points. New cases are going up, active cases were going up, percent positive has actually come down a little bit, and certainly the R-naught has come down a little bit. And so how do you make sense of what is happening with these 4 different data points? Well, this is the messy business of epidemiologists and conducting statistics. This is a really important point about statistics. We do not rely on one data point in isolation. We study each of these elements, each of these data points. We look for trends, and then we listen to our community, and we decide what our profile is here. And then we make decisions. We make informed decisions. So thanks for joining me on this week's installation of analyzing and tracking our data. If you have questions, please email me at consider@nd.edu. And thanks for joining me. Bye-bye.